There was an article in the Wall Street Journal, and I thought it was interesting. Here's the headline. The cannabis that people are using for anxiety is probably making it worse. Anxious consumers are looking for help, and pot companies have promoted their products as an answer. And they interview a doctor. And basically what she says is that most of my patients, Dr. Beth Salcedo, psychiatrist and medical director at the Ross Center in Washington, D.C., they ask her, is it really working for your patients? And she says, well, of all the patients that I have that are using medical marijuana, all of them are still my patients, and all of them still have anxiety. So her take is that most of them are just getting high, and while they're high, they forget that they're anxious. But the anxiety continues. So it's not really a treatment for it, right? It doesn't really make it go away. It just, they get high. And that's her opinion. So I wanted to get to the bottom of that. And, of course, we've got our resident expert that I love having on the show, Dr. Vince Callahan, who he's the author of a lot of really good things. But the book he's got right now is The Neural Classroom, Restoring the Stressed Brain. And he's the founder of the Florida Institute for Neural Discovery, FIND, and they're out of Florida. So you can check them out at FIND-FL.com, findfl.com. Dr. Vince Callahan, welcome back, sir.
Thank you so much for having me. I love being on your show.
I appreciate that, and I think the listeners appreciate your expertise. And when I was reading this, I thought it was fascinating because, sometimes you see stuff and there's people out there like, oh, no, weed's the best thing ever. And then you have others that, like this woman who I think was fair in her assessment. She's probably doing the prescribing for some of this medication, but is herself saying that, in fact, she feels that they remain anxious. And just to give you a little clip of this here, survey last year found that nearly two-thirds of the people said they would prefer to use cannabis rather than pharmaceuticals to treat a medical issue, according to the survey conducted by the Harris Poll on behalf of a cannabis company. Almost 2,000 adults who were at least 21 years old, and among them 54% said that they had used cannabis, 41% said they'd consumed cannabis to reduce anxiety. Dr. Salcedo says, I have patients who use it every day. They say it really helps. Of course, she goes on to say, my message is that if it were really working for you, you wouldn't be here with me. I thought that was really well put. What say you, Dr. Callahan?
Well, I agree with what the doc is saying. First of all, it all depends on how much you're using. Treatment for anxiety using cannabis can work if it's done in low doses versus the higher doses, because when you use higher doses, it creates more anxiety. And, the logical question is who would use a low dosage of getting high? So people are, especially on the gummies, they're not doing what's recommended. I have patients who will take 10 gummies at a time just to get high for 4, 5, 6 hours. And then when the high goes away, now you've got the anxiety that comes rushing back, the after emotions of what you've done. So I don't know of anybody that, even with a medical marijuana card, that actually does the prescription, so to speak, of what they should be using, because, hey, if I've got a legal way to get high and I don't have to worry about my problems, why wouldn't I do that? But then when the high goes away, you still got the same problems and you still got the same anxiety.
Well, that's interesting. So what is the low dose? How does that work? How does something like that work where it's actually effective for someone?
Well, let's just use the gummies, for instance. I think the patient I've talked to recently about that, who actually does the 10, the dosage would be 1 or 2, and instead of taking 1 or 2, they'll take 10.
And are those like a certain amount of milligrams or a certain percentage of THC content?
Yeah, it's a low percentage of the THC. THC, if you're going to treat anxiety with THC type stuff, essential oils are so much better than actually using marijuana because you don't have all the side effects. when you start using even medical marijuana or the chewables, you start changing personality. You get into paranoia. You get into irritability. You get into lots of things that happen that are there because of the marijuana usage, and you get the dependence on it.
So, let me tell you, and I don't know how this compares, but every now and again, working the hours that I work, I find it challenging. I end at 1 a.m. Eastern time. And like most people, I drink some coffee before work. My work starts at 10 p.m. at night. So the coffee doesn't always wear off right away. So I'm here having a good time talking to everybody all across America. It's a blast. Plus, there's a high that comes with doing a radio show. And once you're done, it's like, okay, what now? Right? So I'm ready to go everywhere at 1 o'clock in the morning, and there's nobody around ever. So I watch TV, I do whatever. Sometimes I curl these 25-pound dumbbells I have, and eventually, on a good night, I'll fall asleep by 2 a.m., once I leave and everything. And on a bad night, 3:30, sometimes closer to 4. So somebody recommended to me to use magnesium gummies. And not somebody, my doctor actually recommended me 500 milligram pills. Then somebody recommended me magnesium gummies. And I got to tell you, those things work really well, magnesium gummies. I feel like it's a big secret that nobody knows about. Have you heard about magnesium gummies for like helping with sleep?
I have, and then there's other natural supplements that have not only melatonin but some vitamin B and some vitamin D in there. And I use one called Put Me to Sleep that I just get at a health store, and that actually begins to calm my brain down at night. And within 30 to 45 minutes, I'm ready to go to sleep, and we'll get 4, 5, 6 hours. Because like you, I'm a night owl. Obviously, I'm up this late talking to you, but I understand the whole wind down thing. But yeah, magnesium is a good natural supplement that is used instead of THC, instead of the medical marijuana. I think it's just too easy to get high these days, and people don't want to deal with their stress, but it causes more stress using the marijuana.
Yeah. Now, this thing you're talking about, Put Me to Sleep, and I don't want you to promote any products that you're not allowed to promote, but just explain it. What's in it?
It's just a mixture of vitamins and melatonin, and it's called Put Me to Sleep. And I don't mind promoting it. It's off the website from Dr. Daniel Amen, BrainMD.com.
I love him. He's terrific. Yeah, he's a really good guy.
He is terrific. So he's got a product called Put Me to Sleep. It actually works. I use it, and it's an amazing product, and it's all natural. And I go right to sleep within 30 to 40 minutes.
That's good to know. I'll definitely pick up some of those. Now, in addition, while we're on that topic, if people are facing similar problems, or whether it's anxiety or having trouble winding down after work, what's your recommendation to people? And not necessarily supplements, just anything, exercises, talking, whatever. I don't know. I'm sure there's a lot of different ways, but people are wound pretty tight nowadays, especially with all of what we see with the economy and global affairs and domestic affairs. What do you recommend for people to relax more? Because people are saying they're using marijuana for anxiety. I got 2 doctors now saying it doesn't really help unless you're saying in low doses and still has side effects. So what's the best recommendation to handle anxiety?
Anxiety is based in worry, and it's based in the what-if scenario. So that not knowing what's going to happen, and you get these ruminating thoughts about what if. The more routine that you can put in your life gets rid of the what-ifs, and you don't go down the worry road as much. For sleeping, I recommend to my patients, turn your screens off at least an hour before you're going to go to bed. People try to fall asleep with their screens. It actually does the reverse in your brain. So the most simplistic thing to do is to actually turn your screens off, turn your TV off, and try to go, start winding down and get into a routine. The most important thing you could ever do is get a natural rhythm, that circadian rhythm going. where you are getting to bed around the same time and you're getting up the same time. And the more you do that, you don't need an alarm clock, to be honest. It's pretty amazing how that works.
Yeah, for me, it works like clockwork. As long as I fall asleep around the same time, I wake up around the same time. And I thrive in routine. I have ADHD, and I don't take any Adderall or anything. None of that stuff ever worked well for me. So for me, routine really, really helps to pretend to be normal. And I swear by routine. I eat the same stuff every day. I have the same coffee. I go to the same place. I'm a real creature of habit in order to maintain that level of normalcy. Otherwise, it's very easy for me to go all over the place. So good advice, Doc.
I'll give you a compliment, if you don't mind.
Sure.
For someone who has ADHD, you've got it going on pretty good, and it sounds like you're extremely healthy. And kudos to you on that.
Well, thank you. It's taken a long time to try to figure this thing out, including getting into radio, because I realized I could not work in a desk job. There was a lot of things like tell me I have to do a spreadsheet, and I'm getting fired. Right? I'm not doing it. It'll never happen. So I've learned in life, and I was like, what kind of work can I do where I don't, I could use my personality and all these ideas and the speed of my brain where I can still thrive without having to type something or do this or do that. And we landed in this place called radio, and thank God for it. It's an amazing thing. So thank you for your kind words. We're on with Dr. Vince Callahan. He's the founder of FIND, Florida Institute for Neural Discovery, their website, find-fl.com. And Dr. Callahan's great because he knows a lot about a lot of stuff. Really, really smart guy. And he's got a brand new book that you got to check out. It's called The Neural Classroom. And we talked a little bit about this last time, and I was fascinated by this concept. I'm oftentimes fascinated by psychological concepts, but the neural classroom, restoring the stressed brain. And the last time we were together, we talked about the stressed brain and how it mimics other things, like in particular some of the symptoms of ADHD, but how the brains are actually different. The stressed brain can be fixed. The ADHD brain can't. and you can manage things, but they're two different things, and the approach to them is interesting. And I find this interesting because I didn't get my ADHD diagnosis until I was in my 30s, and it was because life was just absolutely insane. And I read an article, believe it or not, and I said, wow, I go through that. And I tracked down the doctor in the article, and I was like, I want to talk to you. And he said, I don't see patients privately. But he said, but my colleague here at NYU Medical School, they both taught at NYU Medical, he said he still does have some private practice, and I don't know if he takes new clients or whatever, blah, blah, blah. Anyway, I talked to the guy. I went, had an evaluation with the top guy there, and he said, man, in 38 years of teaching this stuff in medical school, you're like the most classic case I've ever seen, at which time they put me on 4 different stimulants, not at the same time. I tried out 4 different ones. I didn't tolerate any of them. And then I tried the non-stimulant, which worked, but it worked for a little while, then it didn't work. And being normal, like, not shaking my leg, not having to get up, not having to, do what ADHD people do, was cool for a little while. But it was also odd. It was very odd to be able to sit through a very boring, long meeting without getting distracted. And it wasn't a relief. And then I read another article by the CEO of JetBlue. And he said that he would never have found the success that he found becoming CEO of JetBlue if he didn't have the creativity that came with having ADHD. And I said, I'm going to try and go cold turkey here. And that was like 2011. And ever since, I've been flying high off my own crazy and no stimulants. So, Dr. Vince Callahan, what's your approach when you're dealing with folks with ADHD? Because it's a very complex and still growing field, if I'm not mistaken.
And one of the things that I deal with, especially with kids, is the whole feeling that they don't fit in.
Sure.
They're not like everybody else. They're abnormal, so to speak. And so one of the things that folks with ADD deal with is low self-esteem because they're not like everybody else. And I work with them in that area. And if you look at how the brain is different, their brain is processing information so fast. They have short-term memory issues because the information's not getting in. And I just work with them, piece by piece to kind of pull apart, well, here's what's happening and here's what you're doing and here's here's what a non-ADD, I never use the word normal versus abnormal, but
That's
here's
good.
what a non-ADD brain does versus an ADD brain. Here's why yours is unique and different, and here's why you are unique and different, and really focus on those strengths versus, you just don't fit in and you're not like everybody else. But you weren't created that way. And the new term is neurodivergent. Everybody's using that term to mean everything that's not quite the norm, if you will. But typically, a lot of people in their 30s start to diminish some of the symptoms. Their brain kind of catches up, if you will. ADD folks are about 30% behind the developmental benchmarks. And when you realize that, in other words, if I'm 12, I'm dealing with a 9-year-old. I'm not dealing with a 12-year-old. So if you know the 30% rule, then that teaches you how you can relate to and deal with that person more so than if not. And it's just a matter of understanding, especially from parents and teachers. And I try and teach teachers really how to look at that brain and look at how it does things differently.
Dr. Vince Callahan's the author of The Neural Classroom, Restoring the Stressed Brain. I recommend getting a copy for yourself and one to give to somebody. This is stuff you need to know because more and more people have this than you think, both the stressed brain and ADHD, which I've become a passive activist for because it's just such an interesting and complex situation. There's a lot of night owls that listen to this program. Some of you are superintendents of schools. Some of you are on school boards. I know that because I've spoken with you when you've called in, and people that I meet in my day-to-day that listen to the show. And Dr. Vince Callahan, he is an adjunct professor. He trains teachers and others. And if you're a church leader or community leader and looking for a workshop, this is your man, Dr. Vince Callahan. And in addition to that, he's got this amazing book, and you've got to go, and I recommend always get 2 copies. It's worth it. You can keep one, and you can give one to somebody that can benefit from it. The book is called The Neural Classroom, Restoring the Stressed Brain. And this topic of the stressed brain is something that you need to know about because it can be reversed, and Dr. Vince Callahan spells it out wonderfully in his book. Dr. Vince Callahan, let everybody know how they can get a copy of the book and follow the terrific work that you do.
Sure. The book is on Amazon. If you just type in Dr. Vince Callahan on Amazon, the book comes up first on the list there, both Kindle or paperback, either one that you want to do. Our website, we've got lots of interviews and podcasts and resources. Again, you can also type in drvincecallahan.com. It'll take you to that same find website. And I just appreciate being on your show, and thank you for promoting. And I love talking to you, and I just really appreciate it.
You got it, brother. We'll have you back on again soon. Help push the book. God bless.